The following program is brought to you by Naleo TV, the people's platform. This program is freely available to the public, thanks to the generous funding from Hui Pohala and the Hawaii Department of Human Services, MedQuest Division.
Walina mai kako. Welcome to another episode of Let's Talk Healthcare Hawaii, where we help our community understand important healthcare options that can improve your quality of life. In our last episode, we explored the essential roles of how palliative care boosts one's quality of life for patients and families. We shared how palliative care nurses and social workers support individuals living with serious illnesses. Viewers learned that palliative care nurses provide specialized support to help patients manage their symptoms and maintain their quality of life. These nurses become trusted partners, providing both medical and emotional support to ensure patients can live life on their own terms. Additionally, we highlighted the vital role of palliative care social workers who offer emotional support to both patients and caregivers. Since serious illness impacts the entire family, social workers help educate, counsel, and connect families with valuable community resources to ease their journey. In this episode of Let's Talk Healthcare Hawaii, we will focus on the benefits of palliative care. We will explore the powerful benefits of receiving palliative care early in the course of a serious illness. Many in our island communities are living with conditions like cancer, COPD, congestive heart failure, and kidney or liver disease. But did you know that palliative care can make a positive difference in how you and your caregiver feel each day? It also provides emotional and psychological support, ensuring that both patients and their families feel more prepared and supported on their journey. In this episode, we'll dive into how this specialized care can help you stay comfortable, independent, and in control of your healthcare decisions. Whether you're living with a serious illness or caring for a loved one that is, join me and let's talk Healthcare Hawaii. On today's episode of Let's Talk Healthcare Hawaii, we are honored to have a very special guest, Rosemary Burnett, who has and is currently receiving palliative care for the past several years. Hearing directly from someone who has firsthand experience with palliative care is one of the most powerful ways to understand what this type of care truly is and how it could make a difference to you. We're so grateful she's here to share her journey with us all. Welcome, Rosemary. Thank you so much for joining me.
Oh, thank you for having me.
I'm really excited that you decided to come and share your story. I know it's kind of nerve-wracking to do that, yeah?
It is.
Well, I'm glad that you're coming to join us and tell us a little bit about your story. But before we get into that, can you tell me a little bit about yourself?
Sure. Born and raised on Oahu in Honolulu. Pretty much my life was with my grandmother and my great-grandmother, and then of course my mom and the rest of the family. So I learned a lot from my elders, and my grandmother was really my, I don't want to say idol, but my person that I really looked up to and tried to emulate a lot of her things. But that value system that she gave me, the culture system that she gave me, the way of thinking and how to deal with people and things, that really set me up for my life and how I went, and the results that bring me here today. But I did go to St. Andrew's Priory in Honolulu, private girls' school. My best friends are still with me.
Wow, that's
Yeah.
amazing.
We still do class reunions.
Wow.
So it's really nice. And a lot of my friends, we went from kindergarten through high school, graduated together, went to the university and graduated together.
Wow.
and still are, really great friends today, even though we're on different islands and things like that. But anyway, so after the Priory, I went to University of Hawaii at Manoa. And so I am a registered nurse
Oh,
thanks
so
to that
did
program.
you actually practice your nursing here on the Big Island?
No, I'm from Honolulu. So after I graduated, I went to the mainland.
Oh, okay.
In those days, we had competition for jobs with nurses. St. Francis, Kokini, and Queens had their only nursing schools. So they were in competition with us that graduated from the university, and they hired their grads. They didn't hire us.
Oh,
So in order to get a job, we had to go to the mainland. Not all of us, but some of us were from the other
mm,
islands, and they went home, and got jobs. But on Oahu was more of a challenge
yeah,
to find a
yeah.
job.
It's so
So
interesting that you have a healthcare background because, thinking about this palliative care program, you probably have a keen perspective on it. How did you actually come across palliative care?
in 2014, I had already retired from my regular job, but I was back teaching part time.
Oh, okay.
There was an eruption going on, and we had a lot of fog
Oh, yeah.
in the air. So I was walking to my car, and I started having difficulty breathing. So I thought, oh my God, I'm getting bronchitis or, some respiratory problems because the air was so thick. I went to urgent care, and they immediately transferred me to Hilo Hospital,
Mm,
and Hilo Hospital immediately medevaced me to Queens.
wow.
And they told me I had a heart attack. And I couldn't put together VOG, respiratory problems, and then it's a heart attack.
Yeah.
Those are not the traditional symptoms that we look for. So, because I hadn't known I had a heart attack, the damage to heart was more than what it should have been.
Oh, yeah.
So, after all the testing at Queens and everything, the doctor told me, there's nothing we can do. We're going to send you home with some medications, and my prognosis for you is 3 to 5 years.
Oh, my goodness.
I was scared. I was anxious. I was frustrated. I was all of those negative. What's
Mhm,
happening?
mhm.
How did this happen? I don't understand. And it didn't make much sense to me. But I came home and kind of decided that I should look for ways that this can be dealt with or fixed. I have a really good private physician, and he got me hooked up with a doctor on the mainland that ended up putting a stent in for me,
Mm.
which helped me get a little more time. And then after that, I changed my cardiologist
Mhm.
to someone that was new and that had explained to me what he could do for me. And he was able to have the hospital at that time, Hilo Medical Center, became a medical center
Right,
with
right.
cardiologists and
Yes.
things that they could do for us. They put in a implant that is a cardioverter and a defibrillator. So that's implanted on my body.
So at that point, when you spoke to your cardiologist at Hilo Medical Center, did he tell you what the diagnosis was?
Congestive heart failure.
Okay, congestive heart
Right.
failure. So then uh, he referred you then to palliative care.
That's right. And
Wow. Had you heard of palliative care before?
I guess I did the ads on TV and, things like that. But I never thought that I needed it.
Ah, okay.
Because I'm so independent, I pretty much take care of myself as best I can. And he referred me. I didn't have to ask,
Wow.
which now I am very grateful that he did that. Um, and 4 years later, still in palliative care.
Wow, that's excellent. Tell me, how did your implant go? Did you need your palliative care nurse to come with you? How how did you go through that experience?
For me, having the implant wasn't so different than what I had knowledge about,
Mhm.
even though when I was a nurse many years before that, uh, implants with pacemakers was relatively rare,
Uh-huh.
and especially here.
Yeah.
So, but I knew about surgery, pre-op care, post-op care, and that kind of and things. And I really trusted my doctor. I really felt that this was going to be helpful and he's going to do a good job. So I wasn't really worried, about that or had, many problems with it. But it wasn't until I actually got into palliative care and the team came and talked to me
Yeah.
about what they could offer me, then I realized that there was something there that could help me. And I didn't really need any physical care, but the kind of care that they really provided for me, the emotional part,
Ah,
the
yeah.
support, um, having someone to talk to and share, feelings. And I mean, there were times when I would be sitting there talking to them, and we're at home. I'm at
Yeah.
home. I'm not in a doctor's office, so I felt, more comfortable and safe in
Sure.
my own home.
Yeah.
And I would blurt out, "This is what I'm dealing with," and then I'd be crying, and
Oh, wow.
they'd be talking to me and asking me questions, and I wouldn't necessarily do that in a doctor's
Sure.
office.
Yeah, that's for
I
sure.
mean,
Yeah.
I would have to be really on the edge,
Yeah, right,
to
right,
do
right.
that. But uh, it was really very comforting. They're so non-judgmental.
Ah,
They ask you questions, they support you, they say the right things, and it makes a difference.
sure. Especially, you shared that you had some anxiety and other things surrounding your condition. And when you went to the hospital to do the implant, although you were aware of it, um, did you need any additional, support, from your palliative care nurse or anyone to go with you?
After the procedure, there is a process where they have to check the device. So you have to go into the hospital for that. And I wasn't familiar with that at all. And I
Oh,
didn't know what it was, how it was going to be, what they were going to tell me.
yeah,
And so
yeah.
that was a very anxiety producing time.
Oh,
And so I did call the office
oh, okay.
and I asked them if there was a nurse that could go with me to this particular appointment. And yes, there was. And they would go with me, which surprised me. It was like, yay, this is really great. So we went in, they did the device check, and then she started explaining all about what she was seeing and everything else. And it was like, okay. So after that appointment, we sat down and talked for a few minutes and explained
Oh, your
what
palliative
I
care
should worry
nurse.
about,
Ah,
what is normal
mm-hmm.
at this point. Don't worry about this. They'll take care of that. And it was like, okay, much, much better.
Oh, okay.
So much
So,
more comforting.
so to have your palliative care nurse after your appointment really helped you
Yes.
um, lower and reduce all of that anxiety that probably most people just go home with it, right? They don't, because nobody wants to keep asking questions at the doctor's office, right? I'm glad you brought up that in the convenience and comfort of your own home, you're
Mhm.
more open to ask these questions. Did you find that if you didn't have this kind of emotional support, would you have maybe had days of depression?
Yes. Anxiety, stress, depression, um, and just there were a lot of ups and downs from when I first had my heart attack, 2014, to the time that I got into having a stent put in, having the defibrillator put in, going to cardiac rehab at the hospital.
Wow.
I learned more things along the way that I hadn't learned before because these were all new things.
Yeah.
And having that opportunity still didn't quite satisfy all of my needs,
Oh, okay.
emotionally,
Yes,
psychologically.
yes.
So having the nurses come to my house
Yeah.
and talk to me about, let me spew out
Yeah.
all of these anxieties, it sort of changed my focus. And so now I have more ups than I have downs. I mean, there's still days because I
Sure.
still have symptoms that pop up now
Yeah.
and then. I still need to go to the emergency room every once in a while.
Yeah.
And um,
Has that reduced a lot though since you've been on palliative care?
yes,
Yeah. So you don't go to the emergency room very often now.
not anymore.
Wow.
Before it was, I got to know the guys on the ambulance.
Yeah, yeah, yeah.
I knew which station they were coming from. And they knew where I live,
Yeah,
or they still
yeah,
know where I live.
yeah.
But
How is it having, a regular team coming to visit you? What kind of difference has that made to you personally?
it's made a lot of difference. It There's a wholeness to the team
Ah,
where it's not just one angle. Like if I go to my doctor, his focus is on certain things.
yeah,
When I go to my cardiologist, they're focused on certain things. They're not, I mean, that's what they're trained to do,
right,
and there's
right.
nothing wrong with that. That's really great. But a lot of times you walk away with questions that didn't get really
Yeah,
answered
you
and
didn't get, yeah,
you didn't have time,
yeah,
or you didn't want to say you didn't understand something, or you didn't know what the questions to ask
sure,
sometimes.
sure.
So with this team, it's easy. It's easy to ask these questions. It's easy to express the emotion.
Mm.
And that has sort of gotten us into a rhythm,
Yeah.
So I know when they're coming and it's like, yay, they're coming. I'm ready.
That's awesome. It sounds like you have confidence in your team.
I do. I
Oh,
really do.
that's wonderful. That's wonderful. What kind of um, impact or difference has it made uh, being on palliative care to you and your family? Any difference that you see?
Well, I think because there's not as many down days as there
Ah,
are up
yeah,
days,
yeah,
um, it's a little more normal. Uh, and my husband doesn't really express a lot about those kinds of things. The guys and their emotions are
yeah.
kind of, more kept to themselves. But I think there's more comfort,
Mm.
um, that he's not always watching me. Do I need to go to the hospital? Are you feeling okay? Do
Oh,
you need
okay.
to sit down? Do you need this? Whatever. So I'm not doing those
Yeah.
kinds of behaviors anymore because I don't need to
Wow.
as much.
So it's allowed both you and your husband to maintain that independence that you folks have come to know. That's wonderful.
Yes.
Versus he's driving you, to the hospital or whatever. No need to do any of that. If you had if you had to say to the viewers out there about palliative care, what would be your advice with regard to people who might just be on the fence? They've never heard about palliative care, or they're just thinking, I don't need that. What would you say to them?
Well, I've learned a lot as a patient that we need to ask questions. We need to ask for help if we think we need it. And we need to be an advocate for ourselves.
Ah,
So when I'm talking to the team and they're asking me these things, and if I'm having a problem, and they're sort of being my advocate when they say, "Well, did you talk to your doctor about that?" And it's like, "Oh, okay, let me write that down. I'm going to ask that question the next time I'm going." So in a sense, they're backing me up,
mhm.
and they're my advocates, in that sense,
Yeah.
which is very, very good. And you know, we need to depend on somebody to be our advocate. And I would really tell people that are watching, find somebody. It could be your spouse, it could be somebody in your household that might be taking care of you or doing things for you. It might be a good friend. Um, Take them with you to the doctor. Let them ask the questions if you can't answer. Um, Let them remember to write down information that you should be
Yeah.
remembering, because sometimes when I go home, like, no, what did he say about
Yeah.
this?
Yeah. Sure.
Kind of thing.
Yeah.
Um, and when you're in palliative care, you're at a point where your memory probably is not as good as it used to be,
Sure.
depending on the disease condition or whatever. So write things down. Have somebody come with you. Have somebody advocate for you so that you get the help you need. I would also say go onto Hawaii Care Choices website.
Mm,
Read about palliative care. Listen to the stories.
yeah.
And then maybe you want to ask your doctor, can you refer me to Hawaii Care Choices? Maybe it's time I get into palliative care, or my mom or my dad or whoever might need that kind of care.
Okay, so Rosemary, you were just saying about um, having an advocate, and that person might be your caregiver as well. The difference palliative care has made to you, particularly on the emotional side, that maybe most programs don't provide. You found a lot of information by just researching it yourself, going to the website. Is that correct?
Yes, I like to know um, whatever. I like answers to questions. So, once I got into this palliative care, then I did a little more exploration, about what might be available. Um, the social worker is going to be coming to see me next week, and I can ask more questions of the social worker, which is great. It's been very helpful um, to give me answers.
That's great. So, based on the experience that you've had thus far, and it sounds like you've been on palliative care for several years, would you recommend people who are watching that are dealing or living with a serious illness, would you recommend that they at least check with their physician to see if they can be referred to palliative care?
Absolutely. It doesn't hurt to ask questions and find out the answers. So ask. It, it doesn't cost anything. And your physician may or may not know a lot about palliative care or what Hawaii Care Choices can offer. So, but still don't be afraid to ask. And don't be afraid to ask again if you don't get answers. Keep asking questions. Um, that's what you can do. And if you have an advocate, have your advocate push. Just that little push sometimes will make a difference.
Make the
You
difference.
got to get your foot in the door.
Absolutely. Rosemary, thank you so much for joining me today and answering these questions and allowing the viewers to understand your journey. And I'm sure that it's going to help them too in making their decision on getting palliative care. Thank you, Rosemary.
Thank you for having me.
Let's highlight a few of the takeaways from today's topic. Number one, better symptom and stress management from the start. Early admission to palliative care means patients receive immediate relief from symptoms like pain, breathlessness, fatigue, and nausea. It also helps manage stress and anxiety, improving both physical and emotional well-being throughout their illness. Number 2, stronger support for families and caregivers. Serious illness affects the entire family, not just the patient. With early palliative care, families receive guidance, emotional support, and assistance in making medical decisions, reducing caregiver burnout and helping everyone feel more prepared and supported. Number 3, more control over healthcare decisions and quality of life. Palliative care ensures that patients receive treatment aligned with their values and goals. Whether they want to stay active, spend more time with loved ones, or avoid unnecessary hospitalizations, early access helps them live as well as possible for as long as possible. Seeking palliative care early leads to better health outcomes, improved emotional well-being, and stronger family support, ensuring that patients and their loved ones have the best possible quality of life throughout their journey. Let's discuss palliative care eligibility. Who qualifies for palliative care? For those diagnosed with cancer, congestive heart failure, advanced renal, kidney disease, advanced liver disease, chronic lung disease, also known as COPD. How are these services paid for? Palliative care is covered under most insurance plans, including MedQuest. You may be responsible for a co-payment based on the type of insurance you have, similar to an amount you pay when visiting a specialist. How does one know they need palliative care? Are you or your loved one experiencing symptoms such as frequent pain, nausea, anxiety, shortness of breath, and/or depression? Is your caregiver overwhelmed, tired, and frustrated? Are you visiting the emergency room several times in 60 days? Do you need to call your physician often? If you've answered yes to any of these, then it's time to consider palliative care. Mahalo for tuning in to Let's Talk Healthcare Hawaii. Today, we highlighted the benefits of early access to palliative care, a service many in our island community are still learning about. If you would like to receive palliative care, please see your primary care physician. By understanding palliative care now, you and your loved ones can make informed choices that lead to greater comfort, peace of mind, and meaningful time together. Mahalo for joining us. This segment will air every Thursday and Sunday at 7 p.m. on Naleo TV Channel 54 throughout this month and next, with a new episode airing the following month. You can also view this on our Hawaii Care Choices YouTube channel and naleo.tv. Mahalo to our ohana and friends who wish to listen to the audio version of this program by going to our website, clicking on events, then choosing the episode you wish to hear. For more information on this episode or to send a question for the next show, please go to our website at www.hawaiicarechoices.org or call us Monday through Friday during normal business hours at 808-969-1733 to drop us a line. I'm your host, Lonnie Weiger, sending you much aloha and compassion until we meet again on Let's Talk Healthcare Hawaii. Aloha, ahui ho.
Mahalo to Hui Pohala and MedQuest. Hawaii Care Choices, Brenda S. Ho, CEO. And special guest Rosemary Burnett.